Hello, everyone. My name is Dr. Joshua Anthony. I'm a second year psychiatry resident at Meharry Medical College, Department of Psychiatry, and I am a behavioral health ambassador for the HBCU CARES initiative on the campus of Clark Atlanta University. Uh, Today, I have a special guest with me, Dr. Callie Hobson. Dr. Callie Hobson is a child and adolescent psychiatrist and adult psychiatrist, and she is practicing in Seattle, Washington. And today, Dr. Hobson is going to share a little bit with us about her profession and, you know, kind of her steps to becoming a child and adolescent psychiatrist. Thank you for being with us today, Dr. Hobson.
Thank you.
Oh, and I almost so must say, Dr. Hobson and I were also classmates at Meharry Medical College, class of 2015.
Represented.
Yeah. Okay, so Dr. Hobson, I will start very easy. Why did you decide to be a child and adolescent psychiatrist?
Yeah, that's a good question. On a personal level, I have a few family members who experienced mental illness, and I was always really curious about, how their brain works and why they experience things the way that they did. So I initially went into psychiatry to help people like them, like my family members. And then I initially did adult psychiatry, and I felt like I was catching people sort of too far into their illness, and I felt like if I could prevent some of this stuff from happening or address it earlier, I could really help shape and change the trajectory of people's lives. So that's why I ended up doing child psychiatry, because I felt like there was uh, more resilience in kids, and they were easier to shape and treat.
Awesome. So, with that, tell me, what does it take, or what are the requirements to becoming a child and adolescent psychiatrist?
Yeah. So obviously you go to med school, and then so 4 years of med school. After 4 years of med school, you have to do an adult psychiatry residency, and that is 4 years. But if you are certain you want to go into child psychiatry, you can sort of truncate those 4 years into 3 years and start child psychiatry fellowship a year early. So it would be 3 years of adult psychiatry residency where you're treating only adults, and then 2 years of a child psychiatry fellowship. And then once you have completed all of those, then you are a full fledged child psychiatrist.
Okay, awesome. Um, Tell us, what are your main responsibilities as a child and adolescent psychiatrist?
Um, so I'm an inpatient psychiatrist. So kids who come in crisis and need to stay overnight in the hospital because they're not safe at home. So as an inpatient psychiatrist, I see about 5 or 6 kids a day, and I'm both addressing their medical needs, psychiatric needs, both medication and therapy. So I basically holistically treat them and run a treatment team comprised of therapists, social workers, case managers. So I'm ultimately the decider of when they can go home, if they've improved enough that they can be safe at home.
Okay. And what is a typical day like for you?
Um, it varies, but typically I get to the hospital around 7:30 or so. I kind of review the notes on the patients overnight. So anything that's happened behaviorally or medically overnight, I take inventory of. We have a treatment team meeting at around 8:30 usually, which involves sort of running all the patients and seeing if there's any things that need to be intervened on really acutely, whether there's any behavioral issues on the unit that need to be addressed. And then I go and see patients, and that usually takes 2 or 3 hours. I'm talking with each individual patient by themselves about how they're doing and anything that they need from me. And then the bulk of my job is writing a lot of notes and documenting, what I've heard from the kids and my treatment plan of what I foresee for them moving forward, including medication changes and therapeutic modalities that we would need to do on the unit.
Okay, that sounds awesome. Now tell me, so you said that you work primarily in crisis, correct?
Mhm.
What are some other career paths that child and adolescent psychiatrists can take?
Yeah, the cool thing about child and adolescent psychiatry, it's so versatile. And it really spans the whole gamut of range of care. Child psychiatrists can be general outpatient psychiatrists, which means they just see patients in clinic and talk about medication changes, or psychiatrists also do therapy only as well. And then they can work in residential treatment facilities, which is where kids stay overnight for months up to years. They can work in the state hospital for children. Um, they can work in our juvenile justice system. Um, there's a lot of different sort of avenues that child psychiatrists can work in. One thing that's been really popular lately is we're trying to um, expand our reach to reach as many kids as we can. So we're trying to consult to pediatric physicians to help them feel empowered to treat kids in their primary care offices. So there's a lot of child psychiatrists that are consulting to primary care doctors as well.
Okay, awesome. So I know a big question that a lot of people have is, how does your job affect your lifestyle?
Good question. And I think that's really person dependent. The nice thing about my job is I can tailor it a lot of how I want it. So the balance of work and my life outside of work can be a little bit how I choose. So I chose a schedule where I work 7 days, including a weekend, and then I'm off for 7 days, which some people wouldn't want to work a weekend, but for me to have 7 days off without working is really, really nice. So there's a lot of flexibility in psychiatry. Some of my colleagues only work a couple days a week and then have a long weekend. And I think psychiatry is really great in that it gives you a lot of leeway of how much or how little you want to work, and making sure you're having a balance of your work and your life outside of work.
Okay, yeah, that sounds very attractive. So, what advice would you give to somebody who's considering a career in child and adolescent psychiatry?
Yeah. I'd say get as much experience as you can talking with providers who are in the mental health field. Our field is pretty challenging emotionally. We're seeing a lot of things that are hard, and you're hearing a lot of difficult stories, and people have been through really hard things. So it's important to make sure that you're understanding that will be part of the job moving forward, and to make sure that you're feeling really passionate about the work. Because if you don't feel that passion to help people with mental health challenges, this job can be really difficult. I'd say take a lot of introspection and think about, is this something that I'm really, really passionate about? And if it is, we need you, and we really, really want you to be a part of the community, because it takes people who are passionate about this job to do it correctly and do it meaningfully. So yeah.
Yeah, that's some great advice. I know you do a bit of advocacy on social media. How can people follow you on social media?
Yeah. So my Instagram handle is Dr. Callie MD, DrKalimd at on Instagram. I'm also on Facebook at the same handle. And please reach out to me with any questions that you guys have. I'd be happy to talk to you about the field more, talk to you about my experience. It's an amazing and really rewarding specialty that can be taxing and can be challenging, but it is completely doable, and it's really really rewarding to help people in this really meaningful way.
Hey, yeah, Dr. Hobson, thank you for your time. Thank you for the advice. Thank you for the insight into um, child and adolescent psychiatry. For everyone else, Dr. Anthony, you can follow me on Instagram, therapy doc, THERAPYDOC. Um, and I'm a behavioral health ambassador for the HBCU C.A.R.E.S uh, program. You can follow them on Instagram at HBCU C.A.R.E.S, and they are on the campus of Clark at Atlanta University. Um, Thank you again, Dr. Hobson, and hopefully we can hear more from you in the future. And I'm sure everyone else who is tuning into this appreciates your words of wisdom.
Thanks so much for having me.